Hello, my name is Dr. Penny Sutcliffe and I'm the Medical Officer of Health with Public Health Sudbury and Districts. I'd like to share with you some difficult news about COVID-19 and also some positive news. The difficult news about which I am really sounding the alarm is the rapid rise in cases that we are seeing, particularly in the city of Greater Sudbury. We reported our highest daily number of cases yesterday, with 32 cases being reported and about 85 cases in total over the last week. Really worrisome is the fact that a number of these cases are those variants of concern. So those are the mutations of the COVID-19 virus that can spread more easily from one person to the next. So we need to do the same things to prevent the spread, but those measures need to be airtight, really close attention to staying home if we're ill, to masking, to keeping distancing, to really only going out and traveling if it is for essential reasons. We do have evidence of community spread of these variants of concern, so that means we can no longer trace for every case where or how they acquired their infection. That is very worrisome because of how easily these are spread, the numbers of cases it can cause, and therefore the numbers of severe illness and tragically also of deaths. So we need to pay close attention to that. And at the same time, we need to keep hopeful and our eye on the end of this tunnel, and that is with the COVID-19 vaccines. So really pleased to know that we've been able to immunize our very vulnerable and long-term care homes, the staff of long-term care homes, the residents of retirement homes. The highest priority healthcare workers are well underway. And this week we're continuing with other healthcare workers. We're continuing with vulnerable populations in our Indigenous communities, be those urban or on First Nations. None of this would happen without really amazing partnerships. And I'd really like to thank all of those partners and agencies and citizens who've just stepped up to wrap their arms around this campaign to do whatever they possibly could, be it as a volunteer or as a healthcare worker. Thank you very much. We're looking forward to beginning to immunize the 80+ population that are not living in long-term care homes or retirement homes in the coming week. So more information about that will be on our website and through many channels, so we get the news out to people about the opportunity to get immunized. And again, this will be throughout our catchment area, not just the city of Sudbury, but throughout the districts. So I do want to thank you all. This is a bit of a mixed message, both the difficult news and the good news. So let's hold on to that hope and let's keep on growing that hope with the things that we can do ourselves to prevent the spread of COVID-19. Thank you very much.